Welcome to my new topic. Bismillah Rahman Rahim. Today our topic is routes of drug administration. So there are different routes of drug administration. Before starting the lecture, I'm going to differentiate between the dose with dosage. What is dose and what is dosage? So dose can be defined as, look at here. Dose can be defined as the quantity or the amount of the drug administered at one time. So it means that quantity or that amount of drugs that can be administered in a single time. For example, at one time, for example, 500 milligram of paracetamols. Now look at here, dosage. Dosage is the quantity or the amount of drug that should be given over times. Mean that, let's suppose a drug, paracetamol, the same drug, that is 500 milligram paracetamol, TDS, you can say TDS, you can say 3 times for 3 days. So it means here the time is properly mentioned. So that's why in this case, this is a little bit different. So here we have mentioned that after the administration of that, how much quantity of drug is administered at one time. For example, 500 milligram of paracetamol. But here we have mentioned that 500 milligram paracetamol TDS for 3 days. This is called given over times. So in this case, the quantity, the amount of drug they should be given, and the you can say should be given over time. Okay, drug dosage form. This is another one. Now, what is drug dosage form? It means that the drug exists and which dosage form. For example, this is tablets. So this is solid unit dosage form, which is intended for oral administration. These are capsule, these are injections, these are infusion, these are solutions, these are creams, and these are suspension, and these are aerosols. So inshallah I will discuss each and every topic in detail, inshallah. Next, now these are the routes of drug administration. Routes of drug administration, how the drug is administered to the patient. So the first one is enteral route. This is called enteral route. The second one is called parenteral route. The third one is called topical route. They are also called injectable. So enteral route is further divided into two: oral route, sublingual route, and rectal route. So it is clear from the diagram. Parenteral route is further divided into three. The first one is intravenous route, the second one is intramuscular, the third one is subcutaneous. Topical or intranasal route, inhalational route, and intravaginal route. Now look at here. This is the different type of administrations: IV, intravenous, intramuscular, subcutaneous route of administrations, intramuscular, subcutaneous, and intravenous route. So look at here. This is intravenous administration. So muscle with vein. So it has different angles. I think look at here. This is intravenous, how the drug is administered through IV, and this is subcutaneous. Look at the angle. So the angle, this is 120, and this is 90 degree and 60 degree. So there are different angles which are used for the drug administration. This is integumentary system, skin. This is the epidermis, the outermost layer of the skin, and then the second layer is called dermis, while the third is called subcutaneous, and then muscle with the vein. So this is intravenous injection here, this is subcutaneous, and this is intramuscular injection in 90 degree. So intramuscular, subcutaneous. So there are different routes of administrations, but it need a very technical person to be administer a drug to the patient. These are the advantages and disadvantages of the oral, IV, IM, and subcutaneous administrations. Look at here. These are safety, convenience, and cost. How we can differentiate between oral, subcutaneous, IM, and IV. So let's see here. And safety. This is you can say safety of drug. So the oral, if the drug is administered through oral route, so it means that its safety profile is greater than subcutaneous, and then subcutaneous is higher than intramuscular, and then intramuscular is mean that let's suppose when you are going to administer a drug through IV, so there may be a chances of inflammation, maybe a chances of thrombophlebitis, inflammation of vein and artery. So mean that this is the safe route of drug administrations, while this route is not safe. Now on the basis of convenience, so let's suppose if you are going to administer a drug orally, so oral drug, it is more convenient than subcutaneous, and then subcutaneous is more convenient than IM, and IM intramuscular is then more convenience than IV, so it is less convenience IV. Now look at here on the basis of cost. So let's suppose if IV intravenous drug, if it is injected to the patient, so mean its cost is too high if it is compared with the IM. So this is called orders, and this is called ascending and descending order. It means that IV route, whenever we are going to administer certain drugs through IV route, so it is much costly, and this one is IM intramuscularly, this is on second order, this is on third order, and this is so oral this is the cheapest route of drug administration. It is cheap and it is everywhere available, and you can take it easy. So these are the advantages and disadvantages of the oral, IV, IM and subcutaneous administrations. Now look at here. Now on the basis of bioavailability. So bioavailability, as we know that, so I will discuss it, that what is bioavailability, what is bioequivalence, what is therapeutic equivalence. Actually, bioavailability is the quantity of the amount of drug which is bioavailable. The quantity or the amount of drug which is bioavailable. So the bioavailability of intravenous IV route parentals, they are greater than IM, while the subcutaneous route, they are greater than oral. So it means that the oral, let's suppose if we are going to administer two drugs at the same time, one is injectable and the second one is oral, so the bioavailability of the injectable will be definitely high, 100%, and oral will be low. So look at here on this side, this is low or variables, and look at on the left side, so here the bioavailability is increasing. Now here look at onset of action. So the onset of action of IV route, it is greater than IM, while IM is greater than subcutaneous, and subcutaneous greater than oral. So this is delay, onset of action is delay, it will take long time. Patient compliance. On the basis of patient compliance, that either the patient is following the medications or not. So oral, patient compliance orally is high because it is easy for the patient to take it. So orals, patient compliance, so orally mean if we are going to administer drug orally, so patient compliance is high in oral dosage form, and then it is greater than oral is greater than subcutaneous, and then subcutaneous is greater than IM, and then IM is greater than IV. So mean the patient compliance, it is very low, especially in case of IV injectables. Next. So inshallah, in next lecture I will discuss about the pharmacokinetic and pharmacodynamic advantages, disadvantages, and how the drug is absorbed, metabolized, and then how it can be excreted from the body. So each and everything will be explained in my next lecture.